Thank you. Thank you. Good afternoon, everyone. And I'm very proudly honored to be a part of this mixture of clinicians and periodontics. Very rarely will be getting this opportunity. And I am thankful to Dr. Banshi Sabu and Dr. Amit Gupta for giving us this platform. And thank you, Dr. Sankita, for the wonderful introduction of the problem. And I will be discussing very briefly on oral microbiome in patients with diabetes. So when we were practicing diabetes in one side of the building, and our dental college was on exactly on the other side. There was no interaction. Patients will be referred, but there was no communication between both of us. But somehow, accidentally, I should say, we had some connections and we could do a good number of works with our collaborators on the other side of the building. So that was the very interesting way we moved forward. And we know that diabetes care way back in 1993, periodontal disease is identified as the sixth complication of diabetes mellitus. And after that, uh, okay. And when we discuss about microbiome, we know that it's a collection of bacteria, fungi, viruses that live in and around on the body. So we are what we are with regard to our microbiome. This is how it is being interpreted nowadays. It's a component of innate immune system as it profoundly impacts mechanisms of host defects. And when we talk of dysbiosis, it reflects as a change in the composition, diversity, or metabolites of the microbiome from a healthy pattern to a pattern associated with disease or a predisposition to disease. And dysbiosis is believed to play a lot in many diseases, but very importantly, obesity, type 2 diabetes, EAD, cancers, to name a few. And we know that oral microbiota can form symbiotic biofilms that balance pH levels and suppress pathogen growth in the mouth. So it is very important. And when we had this interaction, as I told earlier, we have been looking into various aspects because we are having patients here and we was referring them. So when we sit together, we have been trying to look this and we have been seeing what is the effect of non-surgical periodontal therapy on insulin resistance in patients with type 2 diabetes mellitus and chronic periodontitis. This is something we have done sometime back in 2015. Then the interest moved on. Then we think whether if we treat periodontitis correctly, whether it will reduce the HbA1c in patients with diabetes, pre-diabetes. So that was also we could present. And later we have seen how it goes with regard to type 1 diabetes. That's a correlation of periodontal disease status with glycemic control, duration of diabetes, and dosage of insulin in adolescent and adult patients with type 1 diabetes mellitus. And later we also seen how it behaves in chronic fibrocalculous pancreatic diabetes. So this is a problem. It is there with us. And when we join hands together, maybe that will reduce the total glycemic burden and altogether the complications that this patient can develop in the future. So this is one thing that I thought I should emphasize because if we could reduce HbA1c to even less, or if we could prevent diabetes, pre-diabetic patient moving on to diabetes, that will actually reducing the burden on not only for the patient but for the society as well. So what are the new insights? How the oral microbiome influences the onset and progression of diabetes and how diabetes affects the other way also, the microbial community in the oral cavity. So we will see what is the impact of diabetes on the oral microbiome, an impact of oral microbiome on diabetes, and what are the recent advances that is coming up, what are the potential future directions, and we'll conclude. So impact of the oral microbiome on diabetes. There is endotoxins and systemic inflammation. The oral cavity harbors a large number of bacteria. Some of these bacteria can enter the bloodstream through gingival tissues, particularly in the presence of periodontal disease, and these bacteria, along with their endotoxin, can lead to systemic inflammation, which may impair insulin sensitivity and increase the risk of developing or worsening diabetes mellitus. So, this is with regard to the endotoxin and systemic inflammation. And we also know that there are many studies which shows how these bacteria behave, but there are some of the studies, the meta-analysis doesn't say it goes the same in all the studies. So there are some challenges or areas for us to look into. Oral microbiome of women with GDM. So we can see that there are some specific bacteria identified in GDM. So how this is going to affect the health of the mother in future as well as the baby. This is some area we may have to have long-term follow-up data. And there are some recent advances with research finding microbial signatures and biomarkers. The shifts in the abundance of certain bacteria species may predict the onset of hyperglycemia, even diagnose prediabetes, and metabolomics and microbial products. Advances in metabolomics have revealed that the metabolic byproducts of oral bacteria such as short chain fatty acid may have a direct impact on systemic metabolic health, and these compounds could potentially modulate insulin sensitivity or contribute to the systemic inflammation. I think there is some change happened with some of the slides, but like to include two more points. One is enterotoxic and systemic inflammation, as well as there is presence of hyperglycemia. Hyperglycemia itself causes the saliva. There is increased glucose in saliva, and there is alternate this bacterial overgrowth in the oral cavity. All these are pushing the patient into uncontrolled diabetes as well as worsening of the periodontal inflammation. And more so, there is a signature, this microbial signature. If you could do the whole genome sequencing and identify this sort of the bacterial colonization is more helpful, or is going to be better control of diabetes or better control of prevention of diabetes, or it is the signature for a person becoming pre-diabetes. If any of the things has actually coming into practice, maybe we will be having focused intervention that will help us in controlling these problems. And the other thing is the metabolomics, that is the thing that is the metabolic byproducts of this bacteria like short chain fatty acid may have a direct impact on systemic metabolic health, and these compounds could potentially modulate insulin sensitivity or contribute to the systemic inflammation. So what are the intervention strategies? So we have strategies to modify the oral microbiome as a therapeutic strategy for diabetes management. Imagine by treating periodontitis or modulating the oral microbiome, if you could reduce the HbA1c or if you could prevent the complication, that is going to be something that is achievable. And we can also think of probiotic therapies to control pathogenic bacteria, have shown some promise in improving oral and metabolic health. More clinical trials are needed to understand the long-term efficacy of these approaches. And several studies have demonstrated that improving oral hygiene in individuals with diabetes can lead to a better glycemic control, as it reduces the inflammation and bacterial load in the mouth, and it has led to increased interest in developing intervention targeting health to potentially improve the diabetes management. And more so, as I have already told, personalized microbiome interventions. As we go more understanding about the microbiome advances, or we would be able to identify specific microbiome that are specific for this worsening of diabetes, maybe we can think of personalized approaches to treat diabetes based on individuals' unique oral microbiome. This is not only for diabetes but for other diseases as well. This change in microbiome, change in gut dysbiosis is affecting disease, and it is actually coming up in a big way as treatment for diabetes, hypertension, obesity, non-alcoholic fatty liver disease, to the tune of autism, depression, cancer. So we can have a big scope with regard to these interventions, and tailored interventions like prebiotic, probiotic or specific dietary changes could be developed to restore balance in the oral microbiome and improve systemic health. And microbiome specific waste diagnostics. that research may bring microbiome space diagnostic tools, that we understanding the microbiome and whether it could predict diabetes, whether it could predict complication, whether it could reduce the progression of complication, that which patient is more likely to develop diabetic retinopathy, this patient is more likely to develop nephropathy. We have seen, and we also have evaluated how retinopathy behaves in patients with periodontitis and without periodontitis, how diabetic food progression varies with this. So this alteration of diabetic oral microbiome is definitely going to change the practice, and it will also maybe contributing to preventing the complications like cardiovascular disease based on the specific microbial makeup in the oral cavity. So there is a connection between diabetes and oral microbiome. It is complex, multifaceted, and we know that it is bidirectional. There is an imbalance. Oral microbiome contributes to the pathogenesis of diabetes and its complications. And which microbiome is actually responsible, or which are the pathogenic bacteria that is contributing to this? To suggest we need more studies, because most of the systematic reviews are focusing to some, but all studies are not pointing to that particular bacteria. Maybe whole genome sequencing or larger sample size being an answer to us. And also we know that what we have in South Asia or India may be different, the publication that is coming from other sites. So advances in microbiome research are opening up new avenues for potential interventions, from personalized therapies to improve diagnostic tools, and further studies are needed to fully understand these relationships and to determine effective strategies for leveraging the oral microbiome in diabetes care. Thank you.